for Family Health Support Services Manager Nate Nimtz and Community Health Worker Scott White. Good morning.
Good morning.
Happy New Year.
Yes, you too. Happy New Year.
Well.
You guys are in the year of change. You've got a lot going on.
Yes, we do. Very exciting.
New temporary clinic is open right now.
Yeah. 300 Blackstone. Yeah.
How's that working out?
It's going really well. Yeah, I think it's. I think the word's getting out for sure. And it's. We're pretty close to our main office. So, it's going really well.
I think for the several times you've been on, you've had different roles at the Center for Family Health.
A little bit,
Yeah.
yeah. So I think I was on as a community health worker at one point, and then support services manager now, of course. So
Yeah, and Scott, you're a community health worker. What is a community health worker?
That's a great question, Bart. Community health worker is a frontline public health worker, a trusted member of the community, providing community resources to our patients. So kind of like being a bridge between the provider and community resources.
yeah. So one of the key things for community health workers, they have lived experience. And I know before we got started, Scott was mentioning that he was on the show back in 2004. You said, right?
2004.
When he was returning from the war. So Scott is a veteran. So that's sort of that lived experience piece for Scott.
Yeah.
So he's able to really help a lot of our patients who are experiencing a lot of different things.
That's great.
And I'm sure you probably had your experiences that were very traumatic while you were
Yes, to say the
overseas.
least, for sure.
See, it's how nice is it for folks to be able to have someone they can relate to, right? Mental health, right? A lot of if you have mental health issues, you feel like something's wrong with you, right?
Right.
But not until you have someone to talk to.
Absolutely.
Talk a little bit about some of the services you guys offer.
Yeah, for sure. So the foundation of the work that the community health workers or CHWs do is what we call the social determinants or social drivers of health, and those are really things that sort of impact your health, right? So it's things like housing insecurity, food insecurity. I mean, we know there's a whole lot more to healthcare than just what happens between you and your doctor, right? There's a lot of things that can impact our health. And that's really the goal of the CHWs, is to connect with folks and help reduce disparities by connecting them with those community resources.
Of course, post-holiday blues are pretty common, right? Kind of getting back into the routine after all that fun. How do you know if it's just the post-holiday blues or if you should maybe seek some additional help?
Yeah, absolutely. That's a good question. So I would say, as far as the holiday blues, right? You're going to have your there's a lot that can impact.
The bills are coming in.
Yeah, the bills.
Oh, the bills. Yeah,
right?
to say the least.
Relationships with family, with friends. And even if the holidays for you weren't stressful, right, it's still really busy and hectic. So I think it's really important that you take time to reset and regroup, and set new intentions for the new year. I think a lot of times we call them resolutions, right, which are great. Resolutions are wonderful, but it's important that we really set small goals that are achievable and reachable. And then of course we always talk about, I know we've talked before about self-care, the importance of mindfulness, relaxation, those sorts of things. Reach out to family and friends for support, and then always, reach out to your primary care provider or, any mental health specialist.
Scott, it's perfectly normal for someone to seek help or want to seek help. What are some things that folks should know just kind of about mental health and the process of seeking some assistance?
Usually with the mental health aspect, we have our behavioral health consultants that primarily deal with that. So on that piece, they would just call us in for such as holistic things like housing, transportation, obtaining their medications and things like that.
Yeah, those are, Scott, as a community health worker, Scott works really closely with our behavioral health consultants. And I think that's there's that really close relationship there because so many of those things that we talked about, those social determinants of health, right? And when you're struggling with different things, it can really impact your mental health as well. Those things all go hand in hand, and that's you know, at the center we call that integrated care.
Yeah,
right?
you
Or
mentioned housing. Of course, someone struggling trying to find housing.
Correct.
That's gonna cause severe problems.
Yeah, for sure. And that's when, you know,
Exactly.
when I talk about the social determinants of health and I explain the social determinants of health, one example that I always use is maybe a patient who's a diabetic, right? And they have a high A1C, and they've met with their primary care provider, and they've talked through those things with them, and they've done, you know, all your traditional things, medications, lifestyle changes, those sorts of things, and something's just not quite sticking. And then, you know, we'll do a social determinants of health screening with the patient, and then we uncover, you know, that there's, housing insecurity or, you know, a variety of different things that may be going on for them. And of course, you know, of course you're not worried about your health when you have all these other things. And that's really where the community health workers come in to help alleviate some of that stress and help provide support.
So you've had quite a history of having community health workers.
Yes.
Have you been able to analyze any data on how having CHWs impact the overall population health?
I mean, I would say when we look at our overall organizational data, right, our organizational goals, I think since we've had community health workers, like you said, for a long time, pretty much since the inception, we've had at least case managers. At that time, we didn't call them community health workers. Through the years, there's been a little bit more of a shift. And I will say within, you know, I mentioned I was a CHW at one point when I became supervisor. And when I joined as supervisor manager, there were myself and 3 other community health workers, and we now have a team of 9.
Oh, wow.
So that shows the growth of the role itself, but also the need in the community,
For sure.
and you know, the insurance companies, the payers, they're all seeing that need. One really exciting thing is Medicaid is going to start reimbursing for CHW services, which is very exciting for this year. So.
Awesome. And you've got a lot of diversity in experiences and background and education that you and your fellow community health workers bring.
Yes, we have a great team. And again, the thing about it, we're all in the same room, so we can all collaborate on if a patient has a certain need. Hey, what do you think about this? Oh, I think this will be a great resource for this patient, or this will be a great resource. So that's the power, you know, of having that team approach that we really embrace at the Center for Family Health.
Well, we sure appreciate you guys coming in today. Keep up the great work of leading our community to better health care.
Yeah, thanks. Great to be
30
here.
years.
Yes.
Nate Nimtz, Support Services Manager, and Scott White, Community Health Worker at the Center for Family Health. More of the morning show after this.
Great job.
All right, thank you.